You're about to spend 8 hours completely unconscious. No awareness, no control, no ability to adjust or respond to anything happening inside your body. And during those 8 hours, your organs are not resting, they are working in repairing severe damage, filtering toxins, running the most critical maintenance cycles your body performs. But here is what almost nobody talks about. The position your body is in while all of this is happening determines how well any of it actually works. 8 hours of static pressure, 8 hours of gravity pulling your organs in one direction, 8 hours of either supporting or obstructing every repair process your body is trying to run. Every single night multiplied by 365 nights multiplied by decades. The damage is not dramatic, it is not sudden, and it slows up slowly. In how your digestion feels, how your heart performs, how fast your brain ages from the inside out. I'm Dr. Max, and today we are going inside what happens to your organs while you sleep. Gravity does not stop working when you lie down, it changes direction. When you're upright, gravity pulls everything downward. Your organs sit in their natural position, supported by ligaments designed for exactly this orientation. When you lie down, gravity pulls everything sideways. Organs shift, fluid redistributes, pressure change, and structures designed for vertical orientation spend 8 hours in a mechanical environment they were not built for. This would be manageable if the body were simply resting. But it is not resting. It is running its most intensive repair cycles. Growth hormone pulses, the immune system activates, the brain clears metabolic wastes. Every major organ system runs processes that can only happen efficiently during sleep. All of these processes require one thing above everything else: unobstructed blood flow to every tissue that needs repair. When your sleep position creates pressure on organs or restricts blood flow, those repair cycles are compromised. Not completely, not catastrophically, but consistently, night after night, year after year. Think of it as internal friction. Every hour in mechanically suboptimal position in an hour where repair is happening at 60% efficiency, where fluids pool where they should drain. 60% every night for decades. There is a valve at the bottom of your esophagus, the lower esophageal sphincter. Its job is simple: stay closed, keep stomach acid from traveling upward into tissue that has no acid resistance. When you lie on your right side, the stomach contents shift directly toward that valve, and then acid pulls against it for 8 hours. The result is silent reflux. No pain, no burning, just acid quietly degrading the esophageal lining night after night. Most people who developed this damage never knew it was happening, because it never hurt. The glymphatic system in the brain's waste clearance mechanism. During sleep, cerebrospinal fluid flushes out metabolic wastes including amyloid beta and tau proteins, the same compounds that accumulate in Alzheimer's patients. Research in the Journal of Neuroscience showed the glymphatic system operates most efficiently in the left lateral position. Left side sleeping produces significantly higher rates of brain waste clearance compared to back or stomach sleeping. When this clearance is impaired, metabolic wastes accumulates, cognitive function declines, neurodegenerative risk increases with every year of suboptimal clearance. Now let's talk about what happens to heart and lungs. The heart sits slightly left of center. When you sleep on your right, the weight of the mediastinum shifts in a direction that alters mechanical load on the cardiac muscle. Studies using cardiac MRI have shown measurable changes in cardiac output and stroke volume between positions. The lungs compound this. The right lung, larger with 3 lobes, is compressed against the liver below and heart beside it when you sleep on the right side. That is why less oxygen reaching the bloodstream. Every repair cycle in every organ receiving slightly less than it needs. Every single night. Now let's talk about the liver and kidneys. Bile, the fluid the liver uses to export fat-soluble waste, is partly gravity-dependent. Right-side sleeping places the liver in the lowest position, causing bile to pool in the bile ducts rather than drain. Stagnant bile increases gallstone risk and creates a subtle hepatic congestion that compounds over decades. The kidneys process 180 liters of blood every day. Curled or prone positions restrict blood flow through the renal arteries, forcing the kidneys to work harder for the same output. A 2026 study found measurably higher filtration rates in subjects sleeping in the left lateral position compared to prone or right lateral. There are 4 organ systems, 4 different mechanisms, but all pointing the same direction. Here is what to actually do tonight. The research consistently points toward one position as the most mechanically supportive for the broadest range of organ systems. Left lateral, sleeping on your left side, with neutral spine alignment. Left lateral minimizes reflux, optimizes brain waste clearance, reduces cardiac strain, improves renal blood flow, facilitates bile drainage from the liver and gallbladder. But left lateral without proper support creates its own problems. Without the right pillow architecture, the spine curves, the shoulder collapses, the hip rotates, and the positional benefits are undermined by new mechanical stress. The head pillow, thick enough to fill the gap between your ear and shoulder. Cervical spine level, not tilted up, not tilted down. The between knee pillow. This is the single most impactful addition most people are not making. Firm pillow between the knees keeps the hips stacked, prevents the top leg from rotating the pelvis and creating lumbar flexion. Pelvis stays neutral, lower spine stays aligned, abdominal cavity decompresses. The torso support. A thin pillow or rolled towel placed along your chest and abdomen prevents you from rolling forward into a partially prone position during the night. Maintains left lateral orientation through the entire sleep cycle. The bottom arm. Extended in front of you, not trapped underneath. Trapping compresses the brachial plexus and restricts circulation to the shoulder. Extended arm, while sleeping, maintain circulation and decompress the shoulder. If you have spent years sleeping on your right side or back, this will feel unfamiliar for the first few nights. That is normal. Most people report discomfort resolving with 5 to 7 nights. One note, if you have a diagnosed cardiovascular condition, consult your doctor before changing a sleep position. 8 hours every night, your body running its most critical maintenance cycles, all dependent on unobstructed blood flow and organs sitting in their neutral position. Right side sleeping silently damages your esophageal lining. Suboptimal positioning reduces brain waste clearance, cardiac and pulmonary compression compromises oxygenation. Curled positions strain your kidneys. Stagnant bile slowly burdens your liver. 5 organ systems, 5 mechanisms, all addressable with 1 positional change and 3 pillows. The aging happening inside you every night is not inevitable. It is mechanical, it is positional, and it is correctable. So, starting tonight, left side, neutral spine, pillow between the knees. Give your organs the environment they need to actually repair you. I'm Dr. Max, stay healthy, and we'll see you in the next video.